yours. We're just making sure we're connecting and everything's working, and then we're going to get started in the next couple seconds. So just give us okay, perfect. Great. This is working. Okay, amazing. Okay, welcome guys. My name is Alex Ruiz. I am the Director of Marketing here at Paloma Health. In case you didn't know, this is our office hour segment where you get to meet with providers like Dr. Sean Zager, who is one of our providers here at Paloma Health, and ask him any questions that you have. It is, an open book. Ask him any questions regarding your thyroid health, and he'll do his best to answer. For those that don't know who we are, Paloma Health, we are an online medical practice, which means that we can see patients virtually from the comfort of their own home. We've had people on road trips and, pull over and take it from the car. That's the beauty of a virtual practice. By online medical practice, we can fully treat you. We can order labs, we can order medications, medication management. What I really love about our providers, and Sean will attest to this and speak more about kind of his approach, is we definitely take lifestyle nutrition into consideration. Those are big components in your treatment plans and make a big difference in your overall care. We also offer a mobile app, which is completely free, full of guides, recipes, and resources for you to enjoy. So without further ado, I'm going to go ahead and pass it over to Sean, and he'll go ahead and introduce himself, and we'll get started with our event today.
All right. Welcome, everybody. My name is Dr. Sean Zager. I'm talking to you from Ann Arbor, Michigan. I am an integrative primary care provider and consultant. I do a lot of consultative care for hypothyroid and Hashimoto's patients. I generally, as you probably, most of you know, it's not a one-size-fits-all kind of thing. So I like to make sure that everyone's having a holistic and individualized approach to their care. Anyway, let's get started. Okay, first question. Is it possible that coffee can negatively be affecting my thyroid? It takes about a week or so to take effect, but when I add coffee back in, all my symptoms flare up. And when I remove it, let's see here. There we go. They all seem to improve. Well, again, just as I was just saying, it's a very individualized approach to hypothyroid and Hashimoto's care, which is why I love it. For this patient, I'd say, follow the symptoms. If coffee does not seem to be affecting you well, then avoid it. There's some people don't tolerate the caffeine. Sometimes if you are adding in sugar or dairy to the coffee, that could be the problem. But certainly follow the symptoms, and, independent of your thyroid care, if coffee is not agreeing with you, I would recommend avoiding it. Okay, next question. I have fibromyalgia and Hashimoto's, and also recent non-diabetic neuropathy. Can Hashimoto's cause nerve damage over time? Should I consider seeing a neurologist? Well, so nerve damage is not a typical endpoint for the Hashimoto's pathology. But, when people have Hashimoto's, they are at higher risk for other autoimmune phenomena, which could affect the nerves. Certainly, if you're having progressive neuropathic symptoms, I do support seeing a neurologist to have them evaluate you and with a further workup as warranted. Okay, I've been looking into red light therapy face masks for skincare. One brand mentioned is now recommended for those with thyroid issues. Do you agree with this? For this one, I have to be honest, I red light skin therapy is outside of my wheelhouse, outside of my expertise. I'm really not very familiar with it. So I'm going to pass on this question and refer that patient or any patients with similar questions to their dermatologist. Next up, can your eyesight be affected by elevated thyroid levels? I feel what seems like a film on my eye where a natural wash can remove it. So I'm a little unclear from this question. Speaking of elevated thyroid levels, we at Paloma do not manage hyperthyroidism or Graves' disease. It sounds like that's what's being described here. There certainly is ocular or eye pathology associated with Graves' disease, but as we don't really focus on that at Paloma, I would certainly refer this person to an endocrinologist for further evaluation. Okay. Next question. Recently diagnosed with subclinical hypothyroidism. What does that mean versus a full hypothyroidism? Okay, so that's a good question. So subclinical hypothyroidism refers to patients whose thyroid function test results suggest an impairment or a decrease in their natural thyroid hormone production, and a potential need for thyroid hormone replacement. But generally, these patients are not symptomatic. So it kind of puts patients into a gray area. There are guidelines around how to manage this. But certainly, if this is a diagnosis that you're experiencing subclinical hypothyroidism, that could be a good reason to catch up with one of our Paloma providers to help parse out the diagnostics of, how far along is your hypothyroidism, is there Hashimoto's associated, and what might your need be for thyroid hormone replacement, if at all. Next question. If there is an optimal TSH and or other thyroid hormone levels for weight loss. Yeah, so there's a lot written on optimal thyroid function test results ranges, and you can certainly see a lot of this online and from various experts, or and there's a lot of controversy about this actually as well. In my practice, I find that so the normal TSH is about 0.5 to 5. Again, it's the beauty of hypothyroidism is that it really is an individualized approach, so it's hard to give a blanket answer for all comers. Some patients do fine when their TSH is somewhere within that normal range, even if it's at the high end of the TSH normal range. But I do find that many patients do best when their TSH is down between about 1 and 2.5. And then looking at other thyroid hormone levels, similarly, it really has to be individualized and depends on what medication you're taking in terms of how we interpret the T3 and T4 levels. So I definitely would want to you'd follow up with a provider to kind of really go through this in detail for your specific case. Are there any supplements that could help boost energy? Well, it's kind of a very broad question. Certainly for hypothyroid care, selenium is fantastic. Making sure that your vitamin D levels are adequate, making sure you're not iron deficient or B12 deficient. These are all can affect thyroid function, and the Paloma supplement has many of these vitamins and minerals in it and can be really appropriate for a lot of hypothyroid and Hashimoto's patients. I guess I would say, there's a whole world of ancient herbs out there that are called adaptogens that we use for adrenal support. It's kind of outside the scope of hypothyroid care, but can be related, but definitely would direct you to reading more about adaptogenic herbs. Next question. Would I benefit from either going off T3 or doing NDT, which is natural desiccated thyroid, instead of doing sustained release T3? Yeah, so I would need to know more about your specific history and what meds you've tried and how you've responded to them to really give a specific answer to this. But, there are many, many thyroid medication formulation options out there. I like to make use of all of them when appropriate. Yeah, I would say, sustained release T3 can be great if you really if you find yourself feeling the real burst from T3, which really has its maximal effect within the first few hours after taking it. Otherwise, you could split T3 dosing into twice daily dosing. Lots of ways to skin the cat on this, and would refer you to your provider to help parse that out. Next up, does NDT natural desiccated thyroid make Hashimoto's worse since it is a pig thyroid tissue? Yeah, that's a great question. And I talk about this with my patients. So again, it depends. Many patients with Hashimoto's do just fine on natural desiccated thyroid. I really like NP thyroid. It's relatively it's clean. It doesn't have a lot of the fillers that some of the like generic levothyroxine would have, and even other brands of levothyroxine. So a lot of patients do very well, even Hashimoto's patients, on NDT. But you're right to bring this up because some patients don't. Some patients, because it is an exogenous tissue from a pig thyroid, it can, in I'd say a minority of patients, worsen Hashimoto's and worsen that autoimmune response. And if I see that, I certainly take them off of natural desiccated thyroid, but it can be followed through thyroid antibody monitoring. Okay, this looks like a long question. Let's see. So on Synthroid Levoxyl, TSH was regularly low normal, but free in total T3, T4 would also be very low or out of range. Currently switched to Armor. TSH seems to be lowering at a much faster rate than T3 and T4 rises. How do I get my T4 and T3 up to alleviate symptoms and hopefully allow my metabolism to work properly? Is it ever correct to ignore TSH or consistently have a very low TSH? Okay, so yeah, I'll probably start from the end there. So I never, and I know at Paloma, we never support chronic TSH suppression. So we never want TSH to be consistently low. It can cause harm in the acute setting and also over time. I've seen it many times. First rule of medicine is do no harm. So no, you do not want your TSH to be consistently low, or ideally ever low. Now, so I will say that when a person is on medication that includes T3, like Armor, like NDT, thyroid, natural desiccated thyroid, it's not uncommon for T4 levels to be on the lower side. This doesn't worry me in particular. It seems that with T3 medication on board, it kind of bypasses the T4 step, which we know that's what it's doing. It's bypassing that conversion. And it seems to be reflected in low T4 levels, which again is not a concern. I think TSH is, while I look at all the thyroid function test results in concert, and it's really important to do that, I still think that TSH is the most important reflector of thyroid function and thyroid hormone replacement need. So I would never think it appropriate to ignore TSH, and then would follow, T4 and T3 accordingly. Again, expecting T4 to be low with natural desiccated thyroid or low normal, and expecting T3 to gradually come up. All right. Is it possible that after a stint of good hormones and balanced periods that the thyroid might act up? After a solid 3 years of what I thought was balanced hormones and regular periods, I'm struggling with weight, fatigue, lack of energy, and brain fog like I've never experienced before. 6 months ago, I had a high prolactin of 26. Then it corrected. Okay. I didn't think much of it since the doctor was mostly concerned about the pituitary, but then I researched how it communicates with the thyroid. Will you please share ways to help thyroid function without having to go on medication? Okay, so there's a lot there. I guess I would say that certainly thyroid function and thyroid hormone replacement need can fluctuate over time. So even if seems like things are real stable, and then that may not last, there may need to be a reevaluation of thyroid hormone balance and treatment as warranted. If your prolactin was high, you should certainly be following with an endocrinologist. I don't know if you are already. That can be related to a pituitary dysfunction that can affect thyroid directly, as you mentioned here. So I would definitely be sure that you're following with an endocrinologist to make sure that your prolactin, that your pituitary gland is functioning correctly. Then you ask for ways to help avoid or to help thyroid function without medication. So I'm always integrative and holistic. It's integrative. So I do support prescription thyroid hormone medication when it is appropriate. But depending on a person's hypothyroid picture, There certainly can be benefit from self-care, regular exercise, following an anti-inflammatory diet. As I mentioned before, there are certain supplements, minerals, vitamins that can be helpful to support thyroid function. The Paloma supplement is a good example of one that contains many of those. I read about 7-keto DHEA helping with weight loss and thyroid function. What's the mechanism? Does it support thyroid function or boost thyroid function by increasing TSH and further damaging the thyroid? Okay, does it support thyroid function or boost thyroid function and further damaging the thyroid? Okay, so I think this is probably a little bit outside the scope of what we do here at Paloma. I would say that the hormones all speak to each other. DHEA is a hormone that's produced in the adrenal gland. It has many different mechanisms. It helps to regulate cortisol. It is a precursor for testosterone and estrogen. Again, all of these hormones, none of them are in a vacuum. They all communicate with each other, including thyroid hormone. So certainly can be affected. But in terms of specific dosing or recommendations for DHEA, would refer you to your primary care doctor or endocrinologist. To my knowledge, if DHEA is low and people supplement with it, it does not cause thyroid damage, to my knowledge. But again, would refer you to primary care or endocrinology to discuss more about DHEA metabolism and supplementation. Is there a correlation between hyperthyroidism and high testosterone levels? So again, we here at Paloma, we really don't manage hyperthyroidism at all, nor do we manage testosterone insufficiency. So I'm going to turf that one and kind of refer you to primary care or endocrinology to help to sort out your hyperthyroid and or testosterone questions. What are some things to keep in mind while taking both Armour thyroid for Hashimoto's and Dianavil for ADHD? Are there negative long-term effects? Well, so definitely good to make sure that all of your providers know what medications you're taking. I guess I would just answer this question by saying, there shouldn't be a problem here as long as dosing is appropriate. Of course, if someone is on too much thyroid hormone replacement, including with Armour or any thyroid medicine, it can lead to symptoms of feeling agitated, anxious, feeling revved, kind of wired and tired, can affect sleep negatively. And similarly, being on stimulant medication for ADHD can cause a similar host of symptoms. So just being aware of that, if you feel any of those symptoms coming on, talking to your prescribers about it and possibly pulling back on dosing. And again, just making sure with Armour that your dosing is just right and that you're not even close to the low end of TSH or even close to being towards the higher end of what would be an appropriate dosing range for Armour. Is it possible to have Hashimoto's with low TPO antibodies? I have been diagnosed hypo and have all the Hashi's symptoms, but my antibodies test low. The way we diagnose it is really with antibody testing. I don't know if you've had so there's TPO antibodies that are the most commonly elevated with Hashimoto's. Sounds like yours have been normal. There are other types of thyroid antibodies, specifically anti-thyroglobulin antibodies and even anti-TSH receptor antibodies. If you haven't been tested for those, you should ask your provider to put those on the next lab order. Sometimes those are positive even when TPO is negative. If those tests are all negative, I think it's very unlikely that you would have Hashimoto's. One other way that it can be diagnosed is through a thyroid ultrasound, but again, probably unlikely to show up with any evidence of Hashimoto's on imaging if all those antibodies are normal. I had a full thyroidectomy and take medication. At times I feel my body vibrating internally, tingling sensations. I've been told I have carpal tunnel, but they don't know what it is. Also low on ferritin. Is this something hypothyroidism people go through? Well, I would say that if your hypothyroidism is being treated appropriately, you really shouldn't have any of those symptoms. And again, that would mean that you're on the right thyroid medication formulation and the right dosing and have the right self-care regimen. So I wouldn't expect those symptoms to be related to your thyroid care if if you're being treated appropriately. It is not uncommon to see iron deficiency with hypothyroidism, as they do kind of contribute to one another. When a person is iron deficient, their thyroid is often sluggish. Follow up with primary care to make sure that you're not iron deficient, and if you are, that you're supplementing with the appropriate amount of iron to correct it. I would like to know if adding a T3 medication to T4 only levothyroxine would help with dry, brittle, and frizzy hair. So the answer to that is it could. It depends on what your numbers look like. But yeah, sometimes T3 medication really does help people quite a bit with lingering hypothyroid symptoms. Not to get into too much of the detail of the physiology in this forum, but for all those who don't know, the T4 medication like levothyroxine has to be converted into the active T3 hormone in the body for it to work and do its job. Some people's bodies do that more efficiently than others. So some people do just fine with T4 only medication like levothyroxine, which is the most commonly prescribed medication, thyroid medication in the country. It's the least expensive. And again, it's fine for a lot of people, but some people do really require some T3 to help bypass that conversion step, and they do really see benefit from it. I was on T4 only with good success, but my free T3 was a little low in the range 2.9, which is, depends what range you look at. But so my doc put me on some T3. I'm only taking 2.5 micrograms and I feel shaky. Should I try NDT instead, although it has more T3, or do I just drop it altogether? Why is this happening? So, just to continue what I was saying, the T3 is not appropriate for everybody. It may not be appropriate for you. There are different ways of prescribing it, whether it's the generic liothyronine or brand Cytomel or compounded T3 or the natural desiccated thyroid. If you're feeling shaky on just the 2.5 micrograms, though, it really sounds like it might not be right for you. And I would just explore other treatment options with your provider to make sure, again, that your dosing and your formulation is spot on. Because it does sound like potentially it's creating too much thyroid hormone in your body, and that's why you're having those symptoms. What can be done about Arctic ice cold feet? So that is a potential symptom of hypothyroidism, although there are many different disease processes that can contribute to cold feet. So it may or may not be related to your thyroid. But from a thyroid care vantage point, I would certainly recommend, with your Paloma provider, making sure that your thyroid function test results are really optimized and that your treatment, thyroid hormone treatment, is optimized if it's already not. If there's a thyroid issue, that should help. That should help with your cold feet. When and why should you get a thyroid ultrasound? Yeah, so thyroid ultrasound is reserved for looking at the anatomy of the thyroid gland. If there is a concern for really thyroid nodules, which can be palpated on exam. For this kind of thing, I typically refer people to their local primary care doctor or endocrinologist, because a physical exam is really helpful to guide decisions about thyroid ultrasound. And obviously, we can't do a physical exam through Paloma virtually. So that's the real reason that we do thyroid ultrasound, is if we're concerned about thyroid nodules or any other thyroid anatomic abnormality. My doctor prescribed Armour as I wanted to try NDT, but the pharmacist gave me Neva thyroid. Is this as clean as Armour? Is Armour a better product? That's a great question. I've heard of Neva thyroid. I actually haven't used it much, so I don't know that I'm going to be able to answer this. I don't know exactly what fillers they use in Neva. I know Armour has corn filler. I usually prefer NP thyroid, as it does not have the same corn filler as Armour. but I'm not very familiar with NEVA, so I'd have to look into this further. But a great question for your Paloma provider to help answer. And our last question, as we're already approaching 12:30, what's the difference between Hashimoto's and hypothyroidism? Okay, well, it's a good one. Very appropriate for many of our patients. So hypothyroidism is an impairment in thyroid hormone production by your thyroid gland. It can happen for many reasons. Sometimes it happens when people have part of their thyroid gland removed or their whole thyroid gland removed. There can be genetic components. The most common cause of hypothyroidism is Hashimoto's, which refers more to an immune dysfunction, an autoimmune phenomenon where your own immune system is attacking your thyroid gland and creating inflammation around the thyroid gland that in some patients can exist without hypothyroidism. Some patients have Hashimoto's and their thyroid function is still preserved, but some patients have Hashimoto's and associated hypothyroidism where they need thyroid hormone replacement. Over time, Hashimoto's can sometimes degrade thyroid function due to the chronic inflammation of it if it's not well controlled. But those are the differences. With Hashimoto's really referring more to an immune dysregulation, and hypothyroidism really more to a hormonal thyroid dysregulation. Thanks so much, guys. This has been great. Really appreciate it.
Thank you, Sean. Alrighty, guys. Thank you so much for attending. That was our March. Can you believe we're in March? Office hours. We have office hours every single month. Sean is also, again, as I mentioned, a provider here at Paloma Health. If you would like to see him as your provider, go ahead and go to our website, and depending on your state and or insurance coverage, you can book an appointment with Dr. Zager. So again, thank you guys so much for attending. Sean, thank you so much.